Dr. Canuso. I'm your host, Dr. Dana Canuso, and today is a very special show. For those of you that know me, you know that I am a podiatrist, and I have taken the more traditional route, working in a regular group practice where we took insurance, we saw people for 10, 15-minute visits, and then sent you on your way. And I've moved to more of a patient-focused practice. We don't accept insurance. We have reasonable rates that people with high deductible plans and insurance plans can come and enjoy a visit with the doctor for longer amounts of time. And today with me, I have someone who is doing a similar thing, but in the primary care aspect of medicine. She is a physician that also has experience in the traditional medicine, but is now transferring over to lifestyle medicine. So my guest today is Dr. Khayriyyah Chandler. Thank you so much for being here. I'm excited to have you because lifestyle medicine is something that even I know very little about, and we're colleagues and physicians. But so tell me a little bit about who you are and how you got here.
Well, I am originally from Philadelphia. I live in Haddonfield, New Jersey now. I have 3 little ones, and I think, when you are in med school and stress is crazy and you make really poor lifestyle choices, and then you have children and you want the best for them and you want to be around to see your grandchildren. And I think that really sort of changed what I thought was being healthy in my personal life to bring it to my professional life. I didn't tell you, but I have a background in theater arts.
Oh, so tell me about Khayriyyah before she was the doctor. Did you grew up in?
So I grew up in Philly, North Philly, and the Winfield area.
Okay.
And I went to a place called Freedom Theater, which is a historically African-American theater in the city of Philadelphia. I spent most of my time there. Most of my long-term friends are there. But I always knew that I wanted to be a doctor from a very little girl. I thought I wanted to be a pediatrician, but then when I found out that you cut them off at 21, I said, I think I need to find something. In the city, we didn't see a lot of family doctors. It was more peds and internal medicine. So I was like, oh, there's family medicine, I'll do that. But a lot of my time was spent in the theater, and right before high school, I came over to Jersey and graduated from Deptford High. And I went to Rutgers Camden. I met my husband there. He's still the director of housing there. And then I went to med school, and I went back over to Pennsylvania. And, just children and everything, we just decided to stay where Grandma is.
Right. That's a good idea. That's where we are. We're down the street from Grandma.
You need Grandma.
So basically, you did the traditional route.
I did very traditional.
Med school.
Yes.
You did your family medicine rotations.
Yes.
You got out into the real world, and then.
And then what I found was that I wasn't practicing what I was preaching. So I was always the one, I didn't realize that I was practicing lifestyle medicine even as a med student. So I would go into mental health clinics and do research-based and student health and be like, the most important thing for you is to eat healthy and exercise, and I don't have time, but here's this webpage. I don't have time, but here's this worksheet. So it was really important to me. And then as medicine changed, because we're both of the same area, medicine changed a lot in a little bit of time. And so with electronic medical records and just insurance and how things were reimbursed, all of that help that I could do and some of that community work, it was just sort of sucked away, Yeah,
I just remember with the whole EMR is electronic medical record.
Yes.
So when you see your doctor typing away, he's not doing that, or he or she is not doing that by choice. It's something we have to do to get reimbursed by insurance.
Correct.
And that is taking his eyes or her eyes off of the patient and taking the time away from the patient.
Yeah, it does.
So it was pretty upsetting.
Yeah, it was a hard transition.
Yeah.
It was a hard transition in terms of payment, how you run your office, what's expected of you, how you were trained, because, essentially we came in and you were trained the same way you were 50 years ago, and then the next year or the year after, things were moving at such a quick pace. So it was really difficult for me to kind of keep that part. But when you see a lot of sick people and you know that there'll be help by just doing what they're supposed to do, or having that foundation and using the tools that we already know that are there for success, like, just general health, food, exercise, sleep, things like that, and really giving them the proper tools and the proper research, because there's a lot of people that will pull them in different areas,
Right.
you know.
And that's interesting too, because medicine has become so specialized.
Correct.
Right? So you used to have a family doctor that would walk to your house. That was your doctor. He knew everything about you, and then you go home. And now you have a surgeon, a podiatrist, cardiologist, and nobody knows what the other person is doing. So then we have medication, you know, overwriting, and just it's a scary reality when it comes to medicine.
It is.
So
it is.
You know, basically our mantra in my practice is medicine the way it used to be, right? You used to have a direct relationship with your physician.
Or we say small town youth center, old school medicine.
Oh, right, exactly, because it's the way it used to be, but which was not always better. Yeah. But now we can use our knowledge with medicine
to combine both,
right? Combine both.
Because technology has good points, but it's not everything, you know?
Right.
And
all the amazing research we have now that they didn't have 50 years ago.
And making sure that you have the right research, that's good research in your hand. And sometimes it is quicker to give that thing, that quick fix. Right. And it's a little bit longer to explain to you the research. So we just want to make sure that you have all the tools that you need for your success, you know?
That's fantastic. So it basically, you being where you are now came out of a little bit of a necessity, you know, and I completely get it. You turn into a mom or dad.
Exactly.
And you realize that what's more important? Like, it's more important that I come home calm and I know that I helped people. I mean, I used to come home so stressed. You know, you see 30 patients a day. Did I remember to write that script? Did I remember? And then it just, it rubs off on your family.
Most people know that I'm a big breastfeeding advocate. And so I have an 8, a 6, and a 4-year-old, almost 9, 6, and 5. And so at one point, you know, I was tandem breastfeeding at one here, and then would have EMR charts. You know, and at that point, you ask yourself, what am I doing?
Right. I was a resident at the time when I had my son, and there was nowhere to breastfeed in the hospital. Yes. So I went to my car. I had surgical scrubs on everything.
That's right.
I'm in the car between cases.
That's right.
And then I had to run back. I mean, it really, when you look back, you just can't, I can't believe that we have to do that.
You're pumping instead of eating.
Right.
But you need to eat. You're like, wait, where's this going?
Yeah, so this is great. I'm so excited to find out about what you do. But we're going to take a quick commercial break. But when we come back, we're going to find out more about your practice, how you help your patients. Perfect. Don't go away. This is really interesting stuff.
Everybody wants cheap airfare, but where do you find it? You call Low Cost Airlines. They specialize in cheap flights, discount hotel rooms, cheap car rental rates, and with a best price guarantee. If you want the lowest prices on your airline tickets or other travel services, call now. That's right, call. That's the only way to get these rates. Experts are standing by 24/7 to get you the cheapest airfare and hotel rates available. So don't wait. Call now.
Hi, I'm Christine Patton, the Juice Girl, and I have a brand new show coming to the RVN network called The Juice Girl Show. I'll be talking about juicing, blending, squeezing, and answering any question you have on how you can feel better and look better with juicing. So I hope you love my new show, The Juice Girl Show, coming soon to the RVN network.
When did you see the sign?
When I needed to jumpstart sales.
Build attendance for an event.
Help people find their way. Fast Signs designed new directional signage.
And got them back on track. Get started at fastsigns.com.
Hi, I'm Christine Patton, the Juice Girl. The Champion Juicer has been my juicer of choice for years. Whether I'm making a glass of juice or a large batch of juice for my juice bar. These juicers are simple to use and so easy to clean. Champion juicers are masticating, cold-pressed juicers. 2 models are available, the Classic 2000 and the new Elite 4000. Besides juicing, both models can make frozen fruit, smoothies, nut butters, sauces, and even baby food. The Elite 4000 Champion Juicer also excels at juicing greens and wheatgrass. These juicers deserve to be called the world's finest. For more information, please visit my website at juicegirlpharmacy.com or championjuicer.com.
Hi, welcome back to Real Medicine with Dr. Canuso. I'm here, if you're just tuning in, with Dr. Khayriyyah Chandler. She is a lifestyle medicine physician, and somehow we got sidetracked during our opening segment. But now I want to find out, what is lifestyle medicine?
Yes.
Because even I just read an article about it. Tell me about what it is.
So really there are 6 tenets to lifestyle medicine. I usually put it down to 4 just to make it a little bit, but it really is the nutrition and what you put in your mouth and the food that it's grown in the environment of what you partake in and where it's grown, and then exercise in the environment that you do it in, and then sleep and stress management are really important foundational skills, as well as the social relationships, lifestyle, your environment in general. And lastly, we don't want people to drink too much or smoke too much. So that one kind of like, oh, where do you put that one?
That's kind of in the food.
Yeah.
Yeah. Well, and basically, every one of those things you mentioned are almost back to like the beginning of time.
Correct.
Where you have to worry about your food. You have to worry about where you're sleeping and how you're sleeping.
Correct.
You have to worry about stress.
Correct.
Am I going to be able to find my next meal or find
exactly.
You know.
Exactly.
And what was the other one?
And
food,
social. Relationship.
Right. Having a village.
Right. Exactly.
Having a village that raises your family and helps with your.
And so what I have patients do is I take them to the foundation and recognize that those things do not only prevent disease, but they can also treat disease. Mm-hmm. And that's really where we're on the boundary of pushing and say, you know what, a whole food plant-based diet can treat heart disease. It can reverse diabetes. You know, we have data with prostate cancer, you know, and so much more. And so, yes, most people say, if I do the right things, you know, I can prevent these things. But if you're already sick, we want to take you by the hand and partner with you so that you can get better.
So what we were discussing earlier is lifestyle medicine is almost a blend of like a physician advocate.
Correct.
Meets your physician, meets a holistic practitioner.
Correct, because it's holistic, because it's all of you. All of those things affect you. You know, your relationships affect you, your environment affects you, as well as the food that you put in your mouth. Those, you're making the components of you. You're regenerating your body by your fuel source.
Right. And it's funny. People, we think nothing of medication that we put in our mouth.
Correct.
Right. But for some reason, people will not eat kale. Like it is like, you know. But I'll take this chemical that someone put in a tablet.
Correct.
And you know, it's just a mindset change. And I think, especially with people with disease.
Correct.
You know,
to actually use that as a resource to treat you, and it's okay to need help. I'm not anti-help. That's not what I do. I'm creating a bridge to where you're 100% where you need to be, and where you may not need medicine. But if you do need medicine, that's okay too. Right. It's okay. But it's really the bridge to say that if you're taking out the foundation, the lifestyle modifications, the lifestyle medicine out of your treatment plan, then what is the treatment plan?
Right.
You know, what are we doing here?
Right.
So of those aspects, the most to me that that has to me the best research, and to me that really made me change my entire practice, is a whole foods plant-based diet. When I saw that if you take this diet and you apply it to your life, you have less than a 1% chance of dying of a heart attack or in vascular disease.
It's
amazing.
amazing.
You know, it's amazing. I saw my grandmother get both of her legs amputated. I really came to like really embrace the research about 6 months, and I remember sitting in that conference room just crying because it could have been prevented.
Yeah.
Because somebody told me that it was nothing she could do but eat food in moderation, but this would have happened anyway.
Right.
And the reality is that's not true.
Not true.
It's 100% not true.
Right. People, you know, I have clients and patients come in all the time, and they come in with diabetes.
Yeah.
And I say, you know, this is something that you don't have to have.
Correct.
You have it because of your environment, because of your lifestyle.
Yep.
I know your mom had it.
Yep.
I know your grandma had it.
That's right.
But that doesn't mean you have to have
That's
it.
right.
And I think it's hard to hear.
Yeah.
And to have a friend that can basically hold your hand and say, we're going to do this together. You know,
Yeah.
we're not perfect. We eat sometimes not perfect things, and we stress and don't exercise, but we all need to help each other, and especially if you are in a disease state.
Correct.
You need even more help.
Yes, you have to recognize that as part of your treatment plan.
And I love what you said in the green room. We were talking about diabetes, and once you're already sick, there is no more eat sugar in moderation.
Nope.
That doesn't pertain to you. That pertained to you 25 years ago.
That's right.
But right now, we need to get out of the sick state.
That's right.
And amp up, you know.
So when you have a heart attack or when you're on insulin, I apologize to you that you can't have this anymore, or I'm really taking away these foods that you really called home. But the reality is that if you want to live longer, if you want to see grandchildren, if you want to get down on that floor and do yoga, if you don't want to have the arthritis, you know, all of those things, you know, if you don't want to have prostate cancer and urinary incontinence, then you need to do these things.
Yeah.
And it's hard.
It's hard to hear.
It is hard to hear, and you have to put effort to it. But it's an everyday effort, and the rewards and you reap the benefits that you can't even speak of.
It's hard to imagine, but if you cannot have, say your favorite food is macaroni and cheese. Nothing is better than a bowl of macaroni and cheese.
Right.
Except for seeing your grandkid graduate from high school.
Yep.
Right? And it seems so stupid, but if you can imagine, every time you see something that you recommend to change, and okay, do I want this or do I want to see my grandson graduate? Simple
I was
things.
having a conversation with my 6-year-old, and she said, I need you to live a long time. I know that we can't control everything, but I need you to live a long time. So you better eat a lot of plants.
Oh, that's cute.
So, you know, I think that the thing is, how can I look her in the eye and say, you know, almost every day I try my best, you know?
Right, we all try our best.
And I want to look her in the eye or look at her children in the eye and say, you know, I worked hard to be here for you in this moment.
Right.
And to me, that bringing that medicine back, and so a lot of that partnership is not in a 15-minute visit. It's not in a 30-minute visit. It's not even in a 60-minute visit. Our goal is to partner with organizations and to create opportunities where, particularly in a group setting, because people do better in a group, like a family setting. So for example, we have a youth summer camp that's starting in August 20th, and we're taking them on a farm, Freehaven Farms in Lawnside. They're gonna learn how to plant, they're gonna learn how to meditate, they're gonna have exercise for children so that they can prevent, so that it's not abnormal to them.
Right.
And then in October, every Tuesday evening, we're gonna come and we're gonna have a plant-based session so that you can go over the fundamentals and have the knowledge to go home with a meal plan, you know, with the questions that's doctor stamped and approved, and we can also help you outside of that follow your labs and your medicine so that you can have all the steps and all the information that you need. But no longer can we think that these big changes will happen between me and you in 15 minutes. No. So currently I'm practicing one day a week for those appointments, and we do a lot of virtual visits, and I use a lot of technology. But the other time is really to get those groups in, to get that partnership, you know, a hospital to say, you know, Dr. Chandler has this program. We want to work with you to create this program here, because Philly is like the hoppin' vegan, you know, place to be. So I can get a plant-based meal with low oil, you know, in Philly with no problem.
Right.
Can I see a doctor in Philly? You know, how backwards is that? Right. So that's what we want to be, that resource for people and for the area, because so many people are making that change. More people are finding out about this information. They're like, yay. Okay, what do I do now?
Right. So you're going to be their advocate.
And that's what we want to do.
Fantastic.
We want to say, no, you do have the right information, or I can help you here. Yeah.
Well, we have to take another break. I am dying to hear more, though, about how we get to see you and the perfect, basically, who comes to see you in your practice. So don't go away. We'll be back right after this commercial break.
When did you see the sign?
When I needed to jumpstart sales.
Build attendance for an event.
Help people find their way. Fast Signs designed new directional signage.
And got them back on track. Get started at fastsigns.com.
Hi, I'm Sylvia, the wine entrepreneur, host of a brand new show called Cooked and Uncorked on RVN TV. Every week at noon on Wednesday, we're going to introduce a brand new wine or spirit with a different chef and their cuisine. It's going to be an exciting way to learn how to pair your food, to sip wine from around the world, and to have a good time. Be there or you might miss your next great wine or your next great meal.
Got a quarter?
Everybody wants cheap airfare, but where do you find it? You call low-cost airlines. They specialize in cheap flights, discount hotel rooms, cheap car rental rates, and with a best price guarantee. If you want the lowest prices on your airline tickets or other travel services, call now. That's right, call. That's the only way to get these rates. Experts are standing by 24/7 to get you the cheapest airfare and hotel rates available. So don't wait. Call now.
Hi, I'm Christine Patton, the Juice Girl, and I have a brand new show coming to the RVN network called The Juice Girl Show. I'll be talking about juicing, blending, squeezing, and answering any question you have on how you can feel better and look better with juicing. So I hope you love my new show, The Juice Girl Show, coming soon to the RVN network.
When did you see the sun?
When I needed to jumpstart sales.
Build attendance for an event.
Help people find their way. Fast Signs designed new directional signage.
And got them back on track. Get started at fastsigns.com.
Welcome back to Real Medicine with Dr. Canuso. If you're just tuning in, I'm here with one of my favorite physicians. I'm not kidding. Dr. Khayriyyah Chandler, and she is a lifestyle medicine physician. And before we left, we were talking about how you bridge the gap between primary care, holistic medicine, healthy eating. I want you to tell me about who comes to you as a patient. Who should be calling you and saying, I need to have you as my doctor?
So it's a big list. So usually I say anybody with cardiovascular disease, diabetes. We're also really known to incorporate integrative medicine and nutrition into depression and anxiety as well.
Okay.
So that's one of my other little babies. As if you have a really high rate for breast cancer or prostate cancer through family, a plant-based diet and some of those things can really, really help you with prevention. And anybody who has really high risk. And then lastly, if you're on a plant-based diet and you need the support of your physician. So if you're, a lot of people say, I definitely recommend a whole food plant-based diet. But if you're on, let's say, a paleo diet where you're eating 20%, and lots of vegetables, and you want somebody to kind of talk, I'll do that. That is a plant-based diet. So I'm not, you have to do this or you have to do this. We want you to eat more plants because we know what research shows with that. But I am definitely willing. So it's really, if you're already in the trenches and you want the support, or if you're treating disease with the most common things, rheumatoid arthritis is another one that is also help with it as well. So we do a lot. But, or any of those people,
right,
in your family that have that disease.
Everybody.
It really is.
Everybody. I'm sure it has to be over 50% the number of people who have one or more comorbidities.
Of course.
It's just,
hypertension, cholesterol.
Right. And even pre-diabetes.
Pre-diabetes, PCOS, heavy menstrual cramps have been known to help with the plant-based diet.
Right.
The list is very long.
And I don't know why as a society we are okay saying, I can take this medicine, but I'm not sure about eating plants.
And even so, medical compliance is not very high in American culture. Right. So you say, well, thank you, doctor, you take that medicine, but do you actually take it?
No, it sits there.
But at least if you're listening to me about a plant-based diet, we form a relationship. You may not take all the advice that I have on the first time, that's okay. That's not what my expectation. My expectation is never perfection. But if you hear me, you listen to me, and you take a little nugget with you and you grow that, imagine where you could be in a year or two.
And it's
10.
not just them listening to you, it's you listening to them. Sometimes, we
Yes.
have, who do you talk to about your diabetes or your hypertension?
That's right.
Nobody. You
That's
go to your
right.
doctor and he says, this is what you have, this is why you have it.
That's right.
But the patient never gets to say, well, I think I might have hypertension because I eat ramen noodles every day. Never dawned on me. We need to listen to each other.
That's right.
And I'm sure last segment you said something about vegan. I know some of you watching are thinking the last thing I'm ever going to be is a vegan. And I think you should be the one saying the last thing I'm ever going to be is sick. Because you have the choice to modify your cells, all the way down to the cellular level, and we just think that it's some higher power, and it is some higher power. I'm not getting into that.
It is.
This amazing body we have, how...
But you have choice.
You have choice.
And your choice affects each and every individual cell. After each meal you eat, something really bad can happen or something really good can happen. And every time you take a breath, something great can happen, right? Well, every time you take a bite, something miraculous can happen. You can actually heal your body with each bite that you take. And so even if you don't believe in one diet fits all, but every bite that you take, you make a choice and say, this is going to help me, or I'm just feeding my soul, or I'm feeding this moment.
Right.
And that's okay to take that choice a couple of times a year if you're preventing disease. If you're treating disease, it's a completely different story.
Right.
But that's what it really is.
Right.
With each step, my bones get better. My fibromyalgia gets better.
I think patients, and I didn't really know this until med school,
Yeah.
your body regenerates all the time.
All the
Your
time.
kidney is a new kidney after how many months?
Exactly.
It's mind-blowing to think that we have that much impact on the turnover of our cells and our organs and even just our skin.
Sometimes it can be overwhelming because you're literally like, wow.
I'm in power.
Exactly. And I tell my patients all the time, I am here for the journey, but it's your journey. You are your most powerful tool in your toolbox. You have everything that you need to make this change. I'm just guiding you, helping you, putting resources in your corner. But really, lifestyle medicine is about the patient and about making change, and nobody can make that change except for you.
Right.
And so that's really an important part.
So I'm sure people are dying to find out how to get in touch with you. Can you just basically tell our viewers how to call Dr. Chandler?
That's no problem. Our number is 856-874-8194. We're in the office on Tuesdays. Our website is plant-based-lifestylemed.com. And we went from Chandler Wellness Care, and now we're the Institute for Lifestyle Medicine and Education. And we have a great Facebook page, and I'm always putting crazy stuff on there. So, like us, and we'll share, and we have fun. So come on in.
Oh, that's fabulous.
Yeah.
And they just call and say, I'd like to make an appointment.
Sure,
I want to be a new
you
patient.
can request it online too. So we try to be as tech savvy as possible. You can request it online. You can give us a call, and we'll get back to you as soon as possible. Yeah, definitely.
Oh, that's fantastic.
Yeah.
And of course, I will have links to Dr. Chandler on my Facebook page. If you want to make an appointment with me, you can call 856-334-9001. You can follow me on Facebook at Dr. Canuso and online drcanuso.com. I thank you so much for coming. This was an absolute pleasure.
It was good.
You will see me at that farm helping with the kids, I promise. And don't go away. We'll see you next Tuesday, 12:30 on RVN TV. Thanks for watching.